And the same with topics like stretching. And back then, one of the things that used to really get to me, Paula, was someone would turn around, let's say on the topic of stretching, and they'd say, sorry, John. And I'd say, yes, what about yourself? And they'd say, yeah, basically you're just talking a whole load of bull. Really? Yeah. Because I've got friends of mine, they've got hundreds of research papers that disprove everything that you're saying and contradict everything. And you say, okay, now you're in a room, there was maybe 50, 60 people, and the person says something like that. How do you come back to that, right?
Yeah.
Nowadays, if somebody says to me, sorry, John, there's a paper that completely contradicts everything you're saying, I'm able to say, great, have we all got smartphones in the classroom? Because I've got my computer here and I've internet. So let's go and find that paper that you're talking about.
Yeah.
Let's go and find that paper. Because oftentimes when you ask a person, could you give me the reference that you're talking, they go, oh, well, I can't remember the reference, but it's a friend of mine, Bob, who's one of the world's leading physiologists, and he told me. You go, okay, so Bob the physiologist, you know.
Yeah.
And it was an argument that you could never win. So people would walk out of the room, and some of them would be thinking, haha, you know, John Sharkey's talking a whole load of bull.
Yeah.
You know, that person showed him. And it was really a horrible place to be because there was no truth in it. Well, the one thing I would say to people is that, okay, so, you know, my background is that I'm a clinical anatomist and I'm an exercise physiologist because from my very earliest days as a youngster, as a child, I've always had an interest in people generally, but then perhaps maybe in movement and that sort of thing. And with the people that I met in the very early days, people who were, you know, influential in terms of shaping the person that I was. And the person that I was, by the way, was shaped very much. I seldom ever talk about this, but I went to school in Northern Ireland and I went to school during the Troubles. So I lost quite a number of my friends to the Troubles.
Oh, wow.
And yeah, and that was a strange thing. So one thing is, if I would never send my kids to boarding school. I don't hold it against my mum and dad for doing that. I think my mum and dad thought that was a good thing to do. They thought that, you know, you'd get a great education. I don't know how any parent can send their children away from them to boarding school during formative years. I love my kids. I love hugging them and kissing them, and I would, you know, I really kind of do anything for them. I really would.
Yeah.
And I want to see them having opportunities and just a chance at life. That's why the whole COVID thing is so detrimental to children. And it really is sad in that regard that they have to experience these things. But that's life. Life is about hard and soft. It is about tragedy and happiness. That is life. And in fact, we need both sides of that coin in order for us to thrive. If we don't have it, then we're all going to end up in a utopia. I mean, this idea of death and going to heaven and having to listen to little babies with wings playing harps, that would drive me. I don't want to go to heaven.
No, we're all going down, all my mates.
I want to go down. There might be a bit more excitement down there, and there might be, you know, I'll take my chances. But no, but so the point I'm kind of making is though that all of these things, all of these experiences, shape the person that I am. And I was really encouraged from a very, very young age. My mother bought me my very first anatomy book, which was Tutora. And she bought me my first anatomy book when I was about 12 or 13 years of age. So she obviously knew that I had an interest in that particular direction.
Very light reading Tutora.
What's that?
It's very light reading Tutora. We had it in nursing. So it's that thick.
But at the end of the day, to me, it's almost not about anatomy. It's almost not about tensegrity or organic tensegrity, as myself and Joanne Avison, that's a phrase we like to use, or bio-tensegrity or living tensegrity, which is Dr. Stephen Levin's model, bio-tensegrity. In many ways, it's really about how can I be a better human being? How can I be a better person? And all of these things, the model that I teach in the 21st century, it's really about trying to help people to be better human beings, better Homo sapiens, and so that we can be better fathers, better partners, better brothers, better cousins, whatever the case may be, or from the female viewpoint, the opposite, so nieces, wives, etc. And that's something that crept up on me, that I didn't realize that that's what I was doing, but it kind of dawned on me that that's really what this is about. So I talk about, for instance, in biotensegrity or in organic tensegrity, I talk about relationships that take us out to the cosmos, or so that's the outer cosmos, or that take us into the inner cosmos. In other words, what's happening deep to the skin. Now, I get people to do something like this with their hand. So I'm standing in a room that seems relatively empty. I know I've got some stuff around me, but I'm doing this and it seems like the room is empty, but I can feel something against my skin because I'm moving the molecules of the air. And there are literally billions of molecules filling this room. I can't see them. Oddly enough, I can feel them if I cause a perturbation, if I do this with the air. So the truth of the matter is that the room is not empty. You know, we can walk through it in the same way as a spacecraft can go from Earth to the moon. So therefore it's going through what they call space. But space is chock-a-block. And so that at the very, minimalist point I can make is that there's a connection there. The molecules are touching me and they're joining you and me, even though you're on the other side of the world. It's a connection. It's a synergy. It's a symbiotic relationship. And so one of the ones I speak about would be trees versus humans.
Okay.
So when you look at trees and humans, and you look at our cellular arrangement, in other words, we're a bunch of cells, billions of cells, but that's what we are. We're walking around as a bunch of cells contained within pockets within pockets within pockets within pockets. Some people like to say bags within bags. I'm not a great lover of the bag analogy. I use a pocket analogy. I've got all sorts of gizmos and toys. Here's a piece of, I have a whole machine thing here that I've done up, but this could be the original lamina of the body, the mesoderm, the original embryonic connective tissue. And you are made of this. Everything comes from this this kind of one lamina. And what happens basically is the first cells that develop are blood cells, and they push like that, which I hope you can see that now.
Yes,
so
definitely.
I'm doing that. So now my finger is wrapped in this connective tissue, and if I pinch them together like that, hopefully you can see that. Now you see that's what you would now call a bilamina. In other words, it's not just one, it's two, but in fact it's only one, because I can separate it back out and it's one. So when we do a dissection and I come to a certain part of the body and I say, now look at this connective tissue, and I might use my hemostat to tease it out, and then I take the blade and I cut it and I pull it and say, look, so that's a bilamina tissue. Oh, look, there's another lamina beneath it. So maybe it's trilamina. And all that is really is the fascia folding back on itself, rotating and folding back on itself. And when you do that, of course, you end up then with tissue that's really tough, and that could be a ligament. You see that? So, but it's all from one. It all came from one. It wasn't that there were two fasciae. People even say the word fasciae. It's a plural for fascia, but there is no plural for fascia. I even use it sometimes because it's convenient, but there is only one fascia. There's only one anything. Now we look at the cells of a tree compared to ourselves. You have what are called tessellated and non-tessellated cells. So in a tree you get one type of cell, and in a human you get another. And then when you look at what a tree needs to have a lot of stiffness and just a small amount of flexibility. Humans need to have amazing dexterity. In other words, we need a lot of flexibility, and we need just a small amount of stiffness. And of course, when we feel stiff, we tend to think that that's either pathology or there's something wrong. We don't like too much stiffness. But then stop and think about the physiology of the tree versus the physiology of humans. So trees breathe out oxygen, and we breathe in oxygen. We breathe out CO2, and trees breathe in CO2. So really, when you make this is kind of comparative anatomy or comparative physiology. We are either end of a spectrum, and trees need us and we need trees. And, God knows that you guys have had a tough time in Australia this year. Number of fires. And the same in Brazil, in the Amazon. Oh, by the way, there's another little thing that a lot of people say that that within the Amazon that they're the lungs of the earth. Well, they're not really. The amount of oxygen that's produced in the Amazon is used up by the Amazon. In other words, that oxygen is not feeding the rest of the planet. I say that because I know that people get panicky and they get a little bit scared. You don't have to get scared or get panicked. These things happen on a different temporal basis. They take a longer period of time. The fact that the trees have been burnt and damaged, it's horrible. And, animals suffered, etc. We lost many species. But the truth is, the Amazon produces just enough oxygen
for the Amazon.
It doesn't get filtered all the way around the world. But my main point is that we need to be protecting places like the Amazon. And we need to look. I don't know what the answer is, Paul and myself, because we're now a global economy. Yeah. We walk into a supermarket here in Ireland in December, and we can see fresh strawberries from Chile, or we can see, so it's a global, or they're from China, whatever. It's a global market, but we're going to have to take cognizance of what it is that we're doing, because this whole COVID, for instance, again, somebody said to me the other day, they passed some comment about, oh, the Chinese eat anything. And I said, no, hang on a second. Don't take that attitude. That's really the wrong attitude. I said, just because something seems a little strange to you to eat, it's almost finger wagging and blaming. And I'm not into that at all. What I'm trying to say is that what we're doing is we are encroaching on the environments of other mammalian species. Yeah. And to the point where, like, the bats their immune systems are being damaged, and their immune systems cannot cope with the COVID, and therefore that's how it makes the leap. So we have to learn from this, and we have to, I'm hoping that, the kids who are coming up will have a better understanding of these connections.
I'd really like to, for me, I'd really like to be able to be smart enough as a planet to still behave so there's still water, there's jellyfish and there's dolphins in the canals in Venice. Our ozone layer's back. They can from the satellite they can see through to Singapore and China. So we've actually, COVID's done such a beautiful thing to the planet, even to the detriment to the human life. So it's almost a win for the planet.
I know what you're saying, and it's a funny thing. Like my house is on, surrounded by gardens. So like every window, I'm looking out here. I look out here. We've got garden, and the amount of wildlife that's been in our garden in the last number of weeks, I've never seen the level of it. Now, it could be that many of them were living in the city, and because the city is shut down, they're moving out more, squirrels and foxes and so on. You'd be amazed what lives in your city. But you do wonder, with the period of time that we've had, as I say, we're into week 12 roughly of lockdown. You wonder what kind of impact that has had on the earth, and has it given the planet a little opportunity to take a deep breath?
Yeah,
it'd be lovely to think so, but I hope that we can learn from these experiences, because for the most part, and I travel the world, as you know, Paula, for the most part, I find humans to be really fantastic. I mean, we can do some horrible things, in certain circumstances, and history has taught us that as well. But really, at the end of the day, the vast majority of people are good people. Their hearts are in the right place. And it's about educating them. And so that's what living tensegrity, biotensegrity, organic tensegrity does for me. It gives me a model, an opportunity to be able to, we start out talking about anatomy and physiology, but we end up talking about relationships, and the tension and compression within relationships. In other words, it's reflected in the language of biotensegrity, which is tension and compression. Okay. And that can be, as I say, if I'm talking to a nuclear physicist, they might be talking about attraction and repulsion in terms of electrons or neutrons, but that's still a form of compression and tension. It's just that the language has changed, but it's actually it's the same but different, as the Asians say. Yeah. So it's a bigger topic. So it's a much bigger topic. And in fact, you were in one of the emails you said to me is you were kind of saying, God, I'd love to ask what would a young John Sharkey say to himself. And I just did a podcast with an old friend of mine, Michael King in Pilates, and it was called A Letter to a Young Anatomist. In other words, if you had the opportunity to send a letter to yourself, to a younger you, what would you say? And it's an odd one, because for anybody who, you know, came to any of my sessions back in the late 80s and early 90s, I'm pretty much saying the same things, would you believe?
Okay.
All these years, yeah, and I'm always saying that time is the great witness.
Time
The
is
human
great
body
witness.
and anatomy. And I used to call it the never-ending story. And it was based on that, you know, Disney had a movie out called The Never-Ending Story. But the idea behind the never-ending story was that nothing ends. There was no beginning and there was no ending. It was a never-ending story. In other words, how many muscles that you have in the body? One muscle. Because it's one muscle that rises and falls throughout the entire body. So anybody who came to that will remember, you know, and I've had emails from people saying, oh yeah, I remember coming listening to you. And that was seen as kind of controversial back then. But I tend to think that all I was doing was putting forward a hypothesis. I wasn't coming in and trying to force it down anybody's throat. And the same with topics like stretching. And back then, one of the things that used to really get to me, Paula, was someone would turn around, let's say on the topic of stretching, and they'd say, sorry, John, and I'd say, yes, what about yourself? And they'd say, yeah, basically you're just talking a whole load of bull. Really? Yeah. Because I've got friends of mine, they've got hundreds of research papers that disprove everything that you're saying and contradict everything. And you say, okay, now you're in a room, there was maybe 50, 60 people, and the person says something like that. How do you come back to that, right?
Yeah.
Nowadays, if somebody says to me, sorry, John, there's a paper that completely contradicts everything you're saying, I'm able to say, great, have we all got smartphones in the classroom? Because I've got my computer here and I've internet. So let's go and find that paper that you're talking about.
Yeah.
Let's go and find that paper. Because oftentimes when you ask a person, could you give me the reference that you're talking? They go, oh, well, I can't remember the reference, but it's a friend of mine, Bob, who's one of the world's leading physiologists. And he told me, you go, okay, so Bob, the physiologist, you know, and it was an argument that you could never win. So people would walk out of the room and some of them would be thinking, you know, John Sharkey's talking a whole load of bull.
Yeah.
You know, that person showed him. And it was really a horrible place to be because there was no truth in it. You know, particularly in stretching, people don't know where the research comes from in stretching. And it predominantly comes from army recruits, collegiate students. In other words, army people will do what they're told to do.
Yeah.
They go on military pack runs, or else it's carried out on sheep and goats and rabbits. And then you've got to be able to make a comparative analysis with humans, and particularly with pregnancy as well. The same with pregnancy, because you can't go running research papers on pregnant women.
No.
You can do retrospective or observational studies, but you couldn't kind of say, jump up on that treadmill and run as fast as you can, and I'll stick a few probes in you and see how the baby's getting on. That would be completely unethical, you know. So it was about trying to have a more mature conversation with people and say, okay, I don't have evidence back then. I don't have, you know, a research paper. Because even, by the way, when I was doing my first degree, I wanted to do a paper on stretching, but it was pre-stretching in terms of sport. And the ethical committee wouldn't allow me to do it. And the reason they wouldn't allow me to do it was because the investigation was looking at risk of injury. So before you go into your research, you can't have a bias and say, but I know they won't be injured. There's a risk of injury. And so a university would never take on a research paper where there was a risk that somebody could get injured, because if they do get injured, then they're going to sue you, or they'll sue the university. So the universities wouldn't allow those type of research papers back in the late 70s, early 80s. You know, so the information that we had, I think, was very immature and very poor. Now, of course, we have a lot more research, a lot more science, gold standard, peer-reviewed science, which informs us. And as I say, we're also in a place where if somebody says to me, well, there's a paper that contradicts everything you're saying, John, it's brilliant to have Google to be able to say, well, you know, can you get that paper, pull it up online and show it to me, and let's have a conversation. And then generally speaking, you find they can't find it.
So,
you know, oddly enough.
Stretching or not stretching? If we're going to advise, give some tips for the people that are listening to this and watching this. What do you?
Well, I think rather than me just simply tell a person what to do, I think, it's a little bit like rote learning, Paula. What I would say to people is this. I think part of my job as an educator is to try to empower the people who are listening to me and not to force an opinion down their throat. So what I would say to them is, my recommendation to you is this. Look up the word stretch, to stretch, or stretching. Look up the etymology of that word. Look up the root meaning. Where did it come from? People use the word stretch, to mean all manner of things. Or he was sent away. He did a stretch for 3 years. So we're in the home stretch. In terms of racing. You know what I mean? The word stretch can mean several different things. So, and this is one thing that I try to encourage people. Like if I said to you, what does the word contract mean? So we use the word contract in touch therapies, in movement therapy, in exercise science. We use the word contract all the time. But then I'd say, well, then what does it mean? If it's a word that you're using in common parley every day of your professional career, so this is how I'm going to influence people. I'm going to say to you, why would you be happy with using a word that you don't even know what the meaning is? Now, if you know what the meaning is, well, then you can say, well, then tell me what it means. So we'll go, I hate putting you on the spot, Paula. What does the word contract mean?
Well, contract to me says that the normal natural length of the fibre is shortened.
Okay, but can't you do a contraction that goes the other way?
If you're elongating the middle and contracting the opposite ends.
So it elongates and shortens.
Yes, exactly, which is...
Okay,
depending on...
So we have the words concentric and eccentric, yes? But the word contract means to shrink.
So they don't actually shrink.
Well, I'm going to leave it up to people to go and look it up. Look it up on we can do another talk, another occasion, Paula, as a follow-up if we want to, because that'd be nice. And let people come back and say, well, I looked up the word contraction. It doesn't say shrink, but I promise you, it says to shrink. So from a physiology viewpoint, it doesn't make an awful lot of sense. I don't quite know why early anatomists and philosophers, I've traced it back actually to about 2,000 years. That's as far back as I can find the word contract. And you're going right back to Socrates, and it means to shrink. Now, I'm not quite sure what they were thinking of. Maybe, that might look like a shrinking, but that would be concentric, and it doesn't explain then the use of the word in terms of an eccentric contraction, because a lengthening shrink.
Yes.
That they're confusing words. So I would ask people, first of all, do a little bit of homework in terms of trying to better understand what the word stretch, so we're back to stretch now, what the word stretch means. And then we need to ask ourselves, well, is it the most appropriate word? Is it actually describing what it is that we're doing?
Well,
truly stretch connective tissue, human connective tissue, that tissue will never be the same again ever. It'll never be, what embryology gave you.
Yeah, the truth is see that stretch marks.
Stretch marks, you see it on the abdomen of women.
Yeah.
So, in other words, that tissue from the skin to the depths, that tissue truly stretched, and now you see an external reflection of what's happened. And it'll never be the same again. It really won't be. You can do your best to do all sorts of things, but it'll never quite be the same. Now, if I stand here and I do something like this, is that stretching, you see? And to me, that's not stretching. That's dynamic range of motion. I'm going through both physiological and anatomical range. I'm doing something, that's very beautiful. It's really nice, and it's movement. Now, when you get someone like a gymnast or others, and they lie on their back on the ground, they push their backside, their bum up against the wall, and then they let their legs fall out, and then they take out a magazine, they start reading the magazine, and they sit there for 30 minutes, 40 minutes. What's going to happen there is they're going to get something called creep.
Yes.
In other words, they start in this position and they will eventually end out here. And that is truly stretching.
Yeah.
Now, why would you want to do that? You want to do that so that the idea would be that you'd have less resistance to you being able to take your leg, you know, past your head. And I have a pal of mine from Flanagan. He's an incredible guy. Also got a degree in exercise science. And Mark was involved in the sport aerobics or championship aerobics. He was in Australia there for quite some years.
What's his
And
name?
I can
Mark
remember
who?
Mark on one occasion. Mark Flanagan.
Okay, because you
Flanagan,
froze.
Mark Flanagan, Scotland. Yeah, Mark Flanagan from Scotland, great guy. And then Mark was British and European champion and so on in sport aerobics. But I remember once Mark was, you know, going through a routine, and his leg came up, and his knee hit his face, and he knocked himself out. You know, that was the kind of range of motion
Yeah.
that he had. Now you'd have to ask yourself the question: why did he that kind of range of motion in life? I mean, Mark was a champion in championship aerobics, you know, and so that's fine. That's what sport does. Sport requires that somebody has these excessive ranges of motion, but I can guarantee you there's a price to pay. There's a price to pay for that range of motion. Maybe not when you were 20, but when you get into your 50s and 60s,
Yeah.
there will be, and if there isn't, by the way, well, you've won an amazing lottery. It's one of the reasons why I tend not to use the word homeostasis, but I talk about the allostasis and allostatic effect. In other words, that you're constantly changing, your body is constantly changing and adapting, but there's always a price to pay for every single thing that the body does. So me standing here talking to you, there's a price for me to pay for that. In other words, you don't just get the energy for free. You know, there's a price to pay, and that's part of evolution. So when you're involved in these strenuous workouts to be able to give you the ability to do whatever it is that you wish to do in sport, whether it's rugby or whatever, there's a price to pay, believe you me.
Yeah.
And you have to understand that price so that you can then decide whether it's worth it or not. Yes?
Yeah. Yes, absolutely.
And when you're 20, your idea of what's worth something will be completely different to when you're 40 or when you're 60. I'm 60, and I'd like to think I still have a few years left in me, and that I'd like to be able to do things as opposed to being, you know, crippled. And the only time I ever injured myself was with skiing, because I did some crazy things in my younger days with skiing, but I paid a price for it. I paid a price.
Yeah. Well, we're both the same age, so that makes sense.
Really, you're looking better than I am on it though, Paula. That's the truth, believe me. But look, here is a little thing that one of my daughters, Katie, gave me, which is a back scratcher. I love this thing. And what I love about this is that I was speaking with one of my colleagues, Carla Stecco, she's a professor of anatomy. She's based in Italy, in Padua University. And I took a photograph of Carla giving a little presentation. Myself and Carla were doing a presentation together in Germany. And I took a photograph of her standing beside one of her slides, because in the slide, she was talking about neural tissue, and she was just talking about the anatomy of the neural tissue. And she was talking about, her point was to do with something different, but the word telescope was in her description of the connective tissue. And that's why I took the photograph, because I can remember also then listening to Dr. Tom Findlay, he's a guy based in the USA, and Tom was talking about collagen fibers, and he was talking about the anatomy of the collagen fibers, and that the collagen fiber has this kind of a wave-like anatomy, which they call crimp. So it's almost like a coiled spring, so that when you pull it, you take the crimp out of it, if that makes sense. And I was thinking to myself, everybody's using slightly different terminology, but they're really talking about what it is that I'm saying to people for years and years and years, except they're not shining a light on it. They were talking about something else. So let me just give the example, for instance, with Professor Carla Stecco, where she had telescope. In other words, she was saying that the anatomy of the perineural tissue was more like a telescope. So here you have, let's say, for instance, a nerve, or you have a piece of muscle tissue. It doesn't matter what it is. Now, if you take from here to here, and you say, well, if I was to go from here to here, wouldn't that be lengthening? That would be, and wouldn't that be fair to say that you've been stretching the tissue? So I can pull this and I can bring it all the way to here. And I haven't stretched anything. I've created and caused an elongation. But this piece here I can push that back in, and it moved relative to the rest. I can move that piece in to there, and that piece to there. But yet, nothing within this back scratcher actually lengthened. No individual component part lengthened. Yes?
Yeah. Yes, same as the crimping.
Yeah. And so that's really how the human body moves. The human body moves based upon a tensegrity basis, a tensegrity principle. So these are the typical tensegrity models that they use. This model is as much my enemy as it is my friend.
Oh, wow.
Because it's only a model. It's only a model. So in other words, people sometimes look at this and go, oh, don't be so stupid, because this has no breath, it has no life, it doesn't have moisture. You know, it's just a model.
Yeah.
It's in there. It's a model just to explain the scaffolding, the architecture of cells. And this is the architecture of cells is a geometrical, mathematical thing. In other words, you explain it using math. And then this is the visual reflection of the geometry.
Yeah.
Now I know that's a lot to take in for people, because it's got a particular configuration. So you got your different vertices and your faces and so on, and this is an icosahedron, and so icosahedrons, which are also triangulated, this is the basis of cells. There are different shapes, but if it's a different shape, then it can't be a human cell. It could be used in some in the structure of something else, but not in terms of a human cell. You see, fire has molecules, and they have a completely different geometry to human cells, and so on.
It's funny to think that, because fire's so mobile.
Yeah, of course, it's mobile, but it has to be made of something. Everything is made of something. That's matter. That's matter. And so we have solids and liquids and gases. Well, here we have a reflection of the architecture of cells. And what this tells you is that if you move one part of it, the whole thing moves. You can't move one part of it and some part doesn't move. Now, if you were to have something, that was stuck here, then when you move this doesn't move. Well, that's pathology.
Yes.
So it's a really nice model for helping to explain certain things. But if I push that up to the camera, I don't know if you can see it right there.
Yeah.
But there's a little knot. Can you see the knot?
Yes. Oh, yes, definitely. Yep.
Yeah, there's the knot. So that knot tells you that this material, which is meant to represent a continuous material, it's not really continuous. It had to be tied off.
Yeah.
So there is a beginning and an end to that material.
But not to the body?
But not to the body.
Yeah.
In other words, okay, it helps me. We're telling you a little porky pie, a little white lie. We're saying that this is continuous. And somebody could come along to me and say, John, it's not continuous because there's a little knot there. And I go, I know, you caught me out. But pretend that it's continuous, and then we can use it as a model, you see? And then they'll say, well, then if that's the case, what are these guys meant to be? Like this yellow strut. Well, that's meant to be the bone.
Okay.
Because if you took an x-ray of a bone, you look at this guy, you can see that the humerus has an ending there and an ending there. That's a complete falsehood. That's a complete falsehood. And one of the issues we have, for instance, if I bring people into the Department of Anatomy, and by the way, it was the last time I was in Australia, I was down in Griffith College on the Gold Coast. My gosh, what beautiful. An amazing, what a beautiful college and a great team of people working there. But they didn't have an anatomist, actually.
Oh, I thought you were talking about the beach.
They came in and he was giving up several hours, but they didn't actually have an anatomist. Anatomists, believe it or not, are a dying breed. So we're kind of far and few between, which is one of the sad things, because if you don't have an anatomist running your Department of Anatomy, I think that doesn't fare well for the future.
No, I'm surprised.
Yeah, it is. It's unfortunate. And I mean, good luck to the people who are doing the job that they're doing. But it could be somebody coming in with a different background and then trying to play the role of being the department head of a
Yeah.
department of anatomy without being an anatomist. I think, unfortunately, there issues arise. But what a great experience I had, and the facility that they had down there was absolutely amazing. It really was. So what was I saying? Oh yeah. So when you walk into a department like that, you're going to see something like this guy that's over here, that's behind me, the skeleton.
Yeah.
Now, the difference with the skeleton, we'd say, in a department of anatomy would be that that skeleton at one time occupied a real body. This one's plastic, yes?
Yeah. Yes.
But the one that's in the Department of Anatomy, we'll look at that and say, oh, that's a real skeleton. No, it's not. If you look at that skeleton and you learn from that skeleton and you believe that that is in fact a real thing, a skeleton, then you're missing the entire point. Because I could take your forearm, I could hold your forearm with my two hands, and your bone. Now, you have to have good skills to do that, but I can bend your bones. And therapists do this all the time. I mean, that's what craniosacral therapy people do, whether they know it or not.
Yeah.
Even with their fingers, they're creating small little shifts, pliability in the bone. You couldn't do that with a skeleton that's in a department of anatomy because it's completely dehydrated. All of the marrow is gone out of it. All of the blood vessels that transverse it are gone. And it's hard and indurated, and it's unyielding. And that is not what bone is like at all. But this idea that somehow bone is separate to the other stuff is a man-made invention, and it is completely wrong. Bone is only part of a continuum. So I can't remember if you were recording at the time, Paula, when we were talking, but we talked about at one end of the spectrum there being a tree needing stiffness and just a little bit of flexibility so that it can, meet and match the forces acting upon it, like wind, etc. And humans. So we're at the opposite end, where we need lots of flexibility, lots of motility and movement, and just the right amount of stiffness. So we have to have that balance. Well, what's happening, so that's a spectrum. And what's happening in human anatomy and human physiology is that we have one original material, which is the mesenchyme.
Yeah.
There's other words to describe it as well, depending on what part of embryology you wish to start with. But let's just call it the mesenchyme. And basically, that's your original fabric. And then what you do is you deposit specialized cells into that material. Now, if you deposit these red proteins that have the ability to contract muscle cells, then that tissue is going to be brilliant at contracting. If you deposit neural cells, then it becomes specialist at neural activity, and it'll most likely become a nerve. Or if you deposit hydroxyapatite, then it's going to stiffen and harden, and it's going to become what we call cartilage or bone. But all it is one thing on a continuum with speciality. It's not like they're separate parts. They're not.
That's amazing. It's an endless web.
They're just specialities. Specialities that are dictated by both genetic expression and epigenetics. And we know that because we've had cells that were cultured, that were differentiated, and then they were brought up to the space station. So now you're in an anti-gravitational environment.
Yes.
And when you're in an anti-gravitational environment, which means the space station is falling, so you float, the cells changed shape. And when they changed shape, they changed their genetic expression. So in other words, it's not purely about genes dictating to the cell. That's very important. But if you change the shape of the cell, then the cell starts to change its expression. So shape is hugely important in terms of cellular activity. So did we finish on stretching? So back to stretching then, just to finish. What we're doing when we do this
Yes.
That's not stretching. That's just motion and movement, and it's beautiful. And what you don't want to do is don't go beyond the physiological parameters or the anatomical parameters. Stay within them, and stop and think about this for a moment, Paula. You can visualize, as I'm sure our listener can visualize. You can visualize somebody doing a single leg hamstring stretch. Yes.
Yes.
Okay, so if I was back here, I'll bring my camera down so you can. It's a good job I'm not naked from the waist down.
I was going to say, it's like a normal Zoom.
Well, you see, the great thing about Zoom is you could just put a shirt on and be naked from the waist down. You can get away with it. But okay, so I'm going to do this. We say if I stand out here and if I do that, so this is a single leg hamstring stretch, correct?
Yes. Yeah.
Okay. So let me see if I can do. Are you able to stand up? You are.
I can.
Okay, so if you stand up and do a single leg hamstring stretch, I don't need to necessarily see you do it, just as long as you're comfortable doing it. So you do a single leg. Now, with the leg that you're stretching, whatever leg that might be, touch your hamstrings and tell me, do they feel soft or hard?
Actually, they don't feel very tight at all.
Okay, well,
up at the tendon they do.
Yeah, if you tap your muscle, so as you go into range of motion, tap your muscle and see, is it loose or does it feel like there's tension in it?
No, tension. Yeah.
Okay, now, when you go to lengthen any tissue in the human body, the tissue will shorten. Any tissue.
Yes.
Right? That's how you eat. So when food goes into your stomach begins to expand a little bit. You might call that stretching. Let's use the word the way people use it. It's incorrect. But your stomach begins to expand, which means it starts to lengthen. People call that, okay, now it's being stretched.
Yeah.
And so therefore, the spindles, those specialized spindles that are in your stomach, send information to the central nervous system to say, oh, this is lengthening, and the message comes back and says, oh, start contracting. And that's how you start to contract and digest your food.
Okay.
Now, you started up here, but you're already contracting up here. Contraction is part and parcel of what has to happen. And contraction, by the way, regardless of what it means, we know it now means to shrink. That's a conversation we say for another day. But so everything, the predisposition of the human body is to resist what we call lengthening. Okay. That's the predisposition. Yeah. And if we didn't have that, we would not be able to move around in space and time. We wouldn't be able to digest food. We wouldn't be able to poop or pee. We wouldn't be able to do any of those things. And they're all predicated on slightly different temporal parameters, in other words, time. So for instance, your burn reflex has to be incredibly quick, because if you leave your hand down on something that's burning you, the longer it's there, the more damage you're going to get. Whereas if you can take your hand away really quickly, then you minimize the amount of damage. Therefore, the hotter this thing is, the quicker you'll take your hand away. In other words, the reflex is proportional.
Yes.
If it's not so hot, you probably take your hand away, but not as quickly as you would have. And it's the same with lengthening. The faster you try to lengthen, then the more forceful and quicker the contraction. So if I go into a single leg hamstring stretch, my muscle will shorten slowly. Yes?
Yes. Yeah.
Where if I try to do it fast, like a doctor does a tendon knee jerk reflex investigation on you, he taps you with the, I don't know if you can hear that, I'm going to decline that. Yeah. That's another call coming in. But and that's on my mobile phone outside, but it comes into my computer. But doctors will use this kind of hammer. Yes. And they do the hammer test. Okay. And of course, if they tap you lightly, they'll get a small response. And if they give you a harder tap, then it'll be bigger. In other words, they're proportional. Yes? Does that make sense?
Yeah, absolutely.
So the speed of lengthening is proportional to the rate of contraction. Now, when you go into a single leg hamstring stretch, what's happening to your muscle is that your muscle is contracting. It has to.
Yeah,
it's the way the body works. So if your muscle is contracting, but yet you're bent forward, that tells you that the muscle is lengthened but contracting. Yes?
which is
And
what we
it's not
don't want.
moving.
Yeah.
And it's not moving. So in fact, it's an isometrically held eccentric contraction.
Mm. Where we're lengthening the tendons in the capsule.
Well, what you're doing is you're going forward, which means you're lengthening.
Mm.
So the muscle's going to contract, and now you hold it. Because that's what people do. They hold their stretches.
Mm.
So it's an isometrically held eccentric contraction. And I would argue that most people would never stop to think that when they're taking a stretch, they're doing something like this, that this is an isometrically held eccentric contraction of your triceps.
Yeah, you're right.
Stretching, they call it stretching.
Mm.
So there's a huge immaturity in relation to these topics. People just do it and call it stretching, and they have no idea from a physiological viewpoint, from a neurology view, they've no idea what's actually happening. What are they trying to do? Are you doing the stretch in an effort to do what? To reduce stiffness?
Yeah.
Well, what you're actually doing is you're creating more shortening.
Mm.
So if shortening was the issue that you're trying to deal with, you're actually compounding it. And then there's this notion that when my tissues, like for instance, trapezius, constantly a muscle that people feel is short and tight. So what do they want to do with it? They want to stretch it.
Give it an eccentric contraction. Yeah, okay, nice.
And all I'm saying to people is, you're doing exactly what you accuse the medical profession of doing. In the medical profession, of course, I bridge the medical and the complementary medical, because as a clinical anatomist, my job is to teach anatomy to the undergraduate medical students. And then I also have the surgeons and the gynecologists and the anaesthetists coming back, and they want to do a specialist year or two in anatomy. So my job is to teach the anatomy to these guys. And by the way, these guys are working on living human beings. I'm working on cadavers. I can afford to make mistakes. So what these fellas and girls do is beyond belief. They're absolutely magnificent and they're fantastic. I'm trying to change the way in which they view the body. I have to be honest about that. I know my colleague, Dr. Carla Stecco, and a team of others last summer in London, and I'll come back to the stretching thing. We'll finish that off in a moment. But I was invited to give a symposium on fascia at the International Federation of, we have, it's a bit of a mouthful, we have a large umbrella organization called the IFAA, the International Federation of Associations of Anatomists.
Okay.
So each country has an association of anatomists, and then we have an umbrella organization which all of those associations are members of, and it's the IFAA. And the IFAA hold their annual event, I beg your pardon, they hold their event every 5 years. In other words, it's not annually, it's once every 5 years. And I think it's Seoul is where they're going to be holding it the next time in 2020. What are we now? 2024, I think, is the next one.
Provided we get on a plane.
Yeah, well, hopefully. Gosh, keep your fingers crossed. It wouldn't last that time. But for me, this was probably the pinnacle of my career as a clinical anatomist, to be asked to present at the IFAA, because you've got 1,400 people attending this event. It's absolutely huge. And one of my friends, he's a professor of embryology, professor of anatomy, Jaap van de Waal, and many people in Australia will know Jaap van de Waal's name. And Jaap contacted me and said to me, John, he says, it's fantastic that you're being invited to London. He said, that's where I started out as well. I said, what do you mean, Jaap? And he said, I did my very first presentation, he said, at the IFAA, and it was in London. So it's only the second time they've ever held it in London. So it was lovely to be kind of following in Jaap's footsteps.
Yeah.
But I get this, by the way, in my short courses. My short courses would have sometimes 16 people, or maybe a maximum of 30, and they're coming in to do surgical techniques, and we'd have a team of people. I'm the anatomist, so I'd be talking about the anatomy to them, you see. So I do get these kind of questions and comments. But when you've 1,400, and having given a presentation, a surgeon comes up to you and says, or raises a question and says, so John, can I just ask a question? You say, yes, certainly. And they say, so what you're saying is, if I'm doing a retroperitoneal approach to the kidney, and I perform the operation, and if the patient is telling me a month after the operation or 4 months after the operation, that they're suffering with pain in their left shoulder, you're telling me that there could be a connection.
Mm.
And I'm blown away by that. I'm thinking to myself, there's work to be done here. These people don't understand the connection. They don't understand because they think, well, hang on a second, this patient's complaining of pain here. Well, that's got nothing to do with it.
Right.
Because that's down there. And this is up here. And I'm thinking, oh my God, we've so much work to do that people don't understand connectivity, connectedness, continuity, and they don't understand also the embryological relationships in terms of how fascia, forms itself and morphs itself, because there are specific relationships that can help, particularly with surgeons, that I can show them how to be able to get to a particular point and create as little disruption as possible. You can't avoid disrupting it. That's just part and parcel. But it's amazing the basic components that they don't understand.
But
so there's huge work still to be done. But this idea coming back into our business on stretching and contraction, the reason that probably this came to me so early in my life was because there's that movie with, I think it was Bruce Willis in it, where he says, well, the little child says to him, I see dead people.
Oh, yes. Yeah. Yeah.
Well, I see dead people all the time. That is my job because people leave their remains for science. So I'm working with cadavers. And when a person dies, what happens to the body?
Yeah. Well, that's another days of conversation. I believe that and it depends on whether you believe that there's a soul that moves in.
Oh no, but I don't mean about the soul, but I mean like literally in the hours following death, what happens to a human body? In other words, what happens
it just
to the muscle tissue
stiffens and
yes.
Yeah.
And there's a name for it.
Yeah.
What's the name?
I'm trying to think.
Remember, don't worry. It's called a rigor mortis.
That's it. Yeah.
Okay. So what is the stiffening? Rigor mortis is simply the tissues contracting. So if a person dies in a particular position, they will go into rigor. And once they go into rigor, we have a terrible job trying to get them out of rigor. That's why a lot of times we would have departments of anatomy associated with a hospital. And so the donations can reach us, quickly so that we can then embalm them if we're going to use a light embalming, something like teal or something to that effect, or they can be used as fresh frozen cadavers. But the point I want to make for everybody is the body goes into a rigor contraction. And rigor contractions basically mean that they're stiff. It shows you that is the natural preset of tissue in the human body is to shorten, it's to contract. Yeah. So if this is the normal preset of muscle tissue, this is where muscle tissue is when you're alive. In other words, it's already lengthened. Which means that you have a pre-stress. You'll see that if I get a surgeon and we make an incision on the body, on skin, you'll see that the skin doesn't stay there. The skin will actually move away from the margins.
Yes.
The reason it moves away from the margins is because it's under tension.
Yeah. And
so therefore it's pre-stressed, it's pre-tension. Does that make sense?
It does.
In other words, it's already contracting, what you call contracting, you see?
Yeah.
That's the preset. And then any attempt to lengthen it further will cause it to shorten again. So everything in the human body is predicated around trying to avoid lengthening. Everything.
Yeah. So I guess, and we've been having a lovely time for an hour that I've probably been recording, but the thing there is that we're probably stretching capsule, like we're actually opening capsular space longer than making any difference to the actual soft tissue.
Well, that's a big issue, Paul, and you're bang on there. In other words, if somebody says, "Oh, well, I gained, an increase in range of motion," then you got to be able to, make absolutely certain that you're comfortable with the knowledge of where you gained that range of motion. And if you gained that range of motion from the deeper structures, what we would refer to as being ligamentous structures in
Yeah.
anatomy. Now you're in trouble because ligamentous structures predominantly provide stability.
Stability, yeah, that's right, exactly.
If you've now taken a structure that's this length and it has a little bit of play in it, they all have, but if you've taken it and lengthened it, it will never return to its previous length, and now you've lost your first line of defense. You've now lost stability, and of course, because you're a living system, your body will try to make up for that stability.
Yeah.
And where will it make up? It'll need additional tension.
In
and that additional tension will come from either the fascia, which is on a different temporal basis to muscle fiber, or it'll come from muscle fiber, which now means that you're constantly going to feel stiff and you're constantly going to want to stretch it. So as I said earlier, we accuse the medical profession of saying, we say to them, oh, you only treat the symptoms. Well, guess what we do in touch therapies and in movement modalities? We stretch the symptoms.
Yeah.
Stretching the symptoms is not fixing the problem at all. It's just stretching the symptoms. And generally speaking, it's usually compounding the problem. It's usually making it worse.
Okay, so before I said, what would old John Sharkey tell young John Sharkey? So I'm going to turn that around and make it like not a big answer, but what would this John Sharkey like to say to therapists that have been experienced in the industry for years, the therapists when they first start out?
Oh, that's a very easy one for me, because I think just, be true to yourself, because as I said at the very beginning of this, it seems like a long time ago now, but when we started talking at some stage, Paula, today, I said to you that witness. And I think that that's what it's about. In other words, time for me is the great witness, because I've got people who came to my presentations 30 years ago, and they're the witness to it, say, oh yeah, I remember you said that, John. Yeah. So be true to yourself. What I'd say to anybody coming up through the profession at the moment is, take 5 words every week, words that you use on an ongoing basis, within your anatomy or physiology or within massage, and words that you think and say, right, well, I'm going to go to Google, which is a fantastic search engine, Safari, Firefox, whatever you're using, and put the word in and look for the etymology of the word, the root meaning. Where did it come from? Is it Latin? Is it Greek? Is it Arabic? What was, is it a combination, a portmanteau? We say, is it a combination of words? Like tensegrity is, it's tension and integrity, and put together as a made-up word. And many words basically will have a suffix or a prefix in front of it. What do these words mean? Where did they come from? When were they first used? And to what purpose? What were they meant to describe? And is it helping you to describe what it is that you're trying to tell people? And you might find that, no, there's a better word. And I personally think that we should avoid using the word stretching. I think we should talk about shape changing. Because stretching, engineering, and it's believe it or not, steel. If you want to talk about steel and apply certain principles to steel, then the word stretching comes in, because stretching is the ability to resist the structural change. That's what stretching is all about, and most people don't think that's what stretching means.
No, to the point that it's the opposite in the way.
So in fact, we want to encourage motion. We want to encourage movement. And like everything in life, if you have too much of anything, then that's not probably going to be a good thing for the system. If you have too little of anything, that's not going to be good for the system. We tend to live in the middle. And so it's that middle ground that's just the Goldilocks zone. It's just perfect. It's not too hot, not too cold. And that's where humans live. We live in the middle.
Hopefully not stuck in front of tables and desks and computers for hours and hours. Static. The stasis is the thing that I think that is the big problem that we need to address. Movement versus stasis.
And you don't need to have a PhD in anything to truly appreciate and understand that. We need to move.
Yeah, and you were saying before about how the doctors the anatomists didn't, or surgeons didn't have a clue that the one shoulder to another region would be so linked. Where massage therapists have done, you know, a year of study and then years of experience know that just intuitively, because the amount of times we've been touching our clients and patients, we go, well, it's common sense that where they feel it is normally not where it's coming from.
But that's why massage therapists, let's stay with massage or myotherapy and those type of touch therapies. My supposition on that, or my position on that, is that we tend to use the terminology and the language from other disciplines because we haven't got the confidence in ourselves. My God, stand up and shout with the loudest voice from the rooftops that massage therapists and myotherapists and neuromuscular therapists are very well trained from a pedagogic viewpoint, from an educational viewpoint, and we have something to offer. You know, and so therefore, let's not just keep borrowing and taking words from other disciplines because, oh, you know, they know so much more than we do. I'm sorry. Within the study of medicine and anatomy, doctors have not been shown that their anatomy doesn't include a conversation of continuity and connectiveness, not in the way that it is discussed within you know, touch therapies. So we actually have something to offer, but we're never going to really be able to make the kind of strides that we need to make if we keep just relying on the language from other disciplines and accepting that language when we don't even know what the language means. I mean, I promise, if you stand in a room of 30 or 40 massage therapists and ask them, what does the word muscle mean? Most of them won't know that it means little mouse. They won't know that muscularis means little mice. They won't know that, the vast majority of them.
No, I don't. So, yeah, that's something I've learned.
Yeah, but the Greeks thought that if you did this with your forearm, they thought that looked like a mouse running under a bedsheet. So they called it muscularis. Muscularis means little mice. If you look at a pelvis, so I have a pelvis down here, and if you look at a pelvis, so I turn the pelvis on its side, this is your acetabulum, this joint. Well, acetabulum means vinegar bowl, because the Greeks thought that it looked like the little bowl that you dip your bread in, with your balsamic vinegar or whatever. So, you know, it's a beautiful history and they're beautiful words, but they don't tell us anything about either the anatomy, well, it might tell us a little bit about the anatomy, that it's a concave surface that looks like a bowl, but it doesn't really tell us anything in terms of physiology or metabolism, or it doesn't inform us.
No.
And that's functionality. That's beautiful history. But what we need to do is we need to now start reclaiming the land. We need to start reclaiming the territory. And we need to be able to try and say, well, I'm sorry, the word stretch is just not good enough. It's not suitable for what it is that I'm talking about.
Yeah.
You know, I mean, it's kind of crazy, but I think it's to do with a belief in ourselves and finding our place in the world and then being able to stand up for ourselves. I think we lack the confidence. You know,
absolutely.
You know,
absolutely.
People want to be seen to be wearing white coats and stethoscopes around their necks. You know, that's not what it's about at all. That's a cry for recognition that happened in the fitness industry for many, many years, where people were doing what they called fitness testing, you know, and they were doing blood pressure readings, and you're not qualified to do blood pressure readings. Stop doing that. It's a medical thing, you know, but they were desperately looking for recognition. That's what they were looking for. But we're not going to get the kind of recognition unless we have our house in order. And we need to be able to tell the medical profession that you can trust us. You can rely on us. We've been well trained and we know what we're doing. You know, and then we start telling them, you know, as opposed to, you know, relying on words from engineering to describe, you know, human anatomy. I mean, it's, you know, mechanical. Biomechanics. We're not mechanical.
No.
Stop saying that we're mechanical. You know, that came from René Descartes and others, you know, in the 1700s, where they looked at things like watches and clocks, and they thought that, okay, they were mechanistic and they could explain how so they said, oh, well, then we can use the same explanations to explain the human body. That it's predicated or based on the same mechanisms. No, it's not.
No, isn't that interesting? We have to change the whole language of
yes, the whole paradigm, because we are soft matter. And even this, that's harder soft matter.
Yeah.
It's not hard matter.
You watch someone falling. You watch a drunk falling down a flight of stairs, and that's the first thing that will tell you that bone is mobile, because
it's got motility.
And they'll be holding 6 tall bottles of beer. They'll bang, 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 and they won't have dropped. Like, that's rigor mortis is set in to hold those bottles from dropping and breaking. So that's a whole system in itself. Survival.
And before we go today, by the way, there's something that's been troubling me for many, many years.
Okay, far away.
Oh my God! The last time I was in Australia, I meant to do a little response, but Stu Hines did a little thing. He was in his car and he was saying, "John Sharkey." God love the man. He was doing what I can only describe as being a Tom Cruise Irish. He must have gone to the same school as Tom Cruise, of an Irish accent. Of course, Tom Cruise at the time was married to that famous Australian actress,
Nicole Kidman.
And poor old Nicole, well, I think she obviously went to the same school as Tom and Stu. I mean, I think it's really affected Stu. I think Stu only now gets like a million hits on his posts. You know, he's really suffered because of it. And I wanted to do a little response to Stu, but time ran away from me. I never got to do it.
Oh, well, far away. Here's your opportunity.
No, but I mean, if there's anybody out there who can just, who could help Stu, and kind of just embrace them, give him a hug and tell him it's all going to be okay. It's all going to be okay, Stu. It was one of those top of the morning and sure, where would you be away accents. It was the funniest thing. But I'm just sorry I never got it. It's haunted me to this day that I never got the chance to actually do a kind of a retort, But anyway, it did give me a laugh. I enjoyed his attempt of an Irish accent.
Oh, yes. And we all love Irish accents. I was over there last year. I was singing in the Cork Choral Festival because I'm in a choir. And we're over there this time last year. And then I taught a couple of days in Dublin and then a couple of days in London and back home again. And I just go listening to your accents. But, oh, my God, I love your accent. They're going, no. You have an accent because it's our country. So it's the other way around. I had a couple of Smithwicks at the Caverners Gravediggers pub. So,
oh, wow. Fantastic.
Yeah, I love your country.
So, Paula, you can't come over here ever again and not be in touch, because quite a number of people have been in touch with me who I met on my occasions of being in Australia. And I've always met up with them. I've always managed to, meet them for a cup of coffee, or if I can, I try. Centre, and I can understand that, but I try my best to get them out of the city centre and bring them out to where I live, which is up by the coast. Okay. And I think they appreciate that. Well, but I'd love to meet up.
Yeah. Well, to be sure, I'd be happy. I'd be glad to do that.
No, you see, Stu has infected you. There you go. That's exactly what I was afraid of. So,
so you have to do a response. So you got to give an Aussie response.
Huh?
You've got to respond.
Like, that's the thing I wouldn't do, you see. If I tried to do the Aussie response, I'd just insult millions of people.
No, we love it. We love it.
Oh, my God. Everybody on this side of the world thinks that you guys drink, Foster's 4X or whatever. You know what I mean? Yeah. So I'm just not going to insult anybody.
Well, John, it's been such a hoot. It's been fantastic chatting, and I'd love to spend some more time talking over an hour on one other topic some other time. So, I love,
I talked to the cows. I didn't really give you much of an opportunity to ask many questions, because once you ask a question, boom.
Now I've learnt that now. I'll be very wise on my next one. It'll be like the genie in the bottle.
Thanks to everybody in Australia. The emails that I get over the years, the friendships and relationships that I've built have just been fantastic. It's amazing how it's touched. And I've been in contact, tried to respond to emails.
Yeah.
Just lately, because of what's been happening, we've had to do some webinars for the touch therapy profession here in Ireland. We've had a number of them, and then we've also been collating information to put together a document for the return the safe return to professional practice, and things have just gotten chaotic. I mean, really chaotic. But for anybody if I haven't gotten back to somebody, just take a deep breath. I always do my best to reply to people.
Yeah.
I love doing that,
Yeah,
So, and I love Australia.
Well, and if people wanted to come and do any of the courses or anything that you've got, what's the link? Because I always try to put a link down for.
Good grief. I think the best place to go to is, I've got johnsharkeyevents.com.
Yeah.
My Facebook page, so just John Sharkey Anatomy or John Sharkey Dissection, you should find my Facebook page, and also ntc.ie. So ntc.ie, and you'll usually, in the school, you usually get like drop down menus on dissection. So I have a dissection course coming up in Ohio State University in November, this coming November. So hopefully that will still go ahead. And there have been people who have had to cancel and return their fees to them because these people, their clinics have closed. So you can fully understand it. But as of today, I think we have about 28 people booked on, which is pretty amazing. And I think that number will rise once people have a little more confidence and they understand what's going on. And that's with Dr. Carla Stecco again, who will be with me, and also Dr. Neil Thies. If you don't know Dr. Neil Thies' work, if any of the people out there listening, please check up Dr. Neil Thies. He's just an incredible pathologist and another wonderful human being. And also Dr. Niall Galloway, who is in Emory University in the USA, and he specializes particularly in pelvic anatomy and female prolapse.
Oh,
and
wow, okay.
And he'll be joining me as well. So it's going to be a 5-day course, and I think it's going to be a celebration of life and movement.
Yeah.
Because I think it'll be fantastic for us to all meet up in November.
Well, and I'll have people that listen to this like on the portal that are international. So anybody who's from the States or maybe possibly Canada, if it's close enough on the borders.
Yeah, Ohio is right next to
Canada. So hopefully that they'll be able to jump into that because it sounds amazing. It sounds really interesting.
Another wonderful country and great people, Canadians.
Yeah, they sure are.
I find there's a great a correlation between the Australians and the Canadians in particular. I think, they're just really warm people, beautiful people, always make me feel welcome when I'm there. So I always feel very privileged. Yeah. But it was wonderful talking to you, Paula.
Yes, you as well. And I'm going to let you go to work, and it's 9:15. I'm going to start cooking dinner for myself. So, which might be a glass of red wine and some twisties. Who knows?
Yeah. So nothing new. Nothing new.
Nothing new. Yeah. Australians. Thank you so much again. It's been a pleasure.
Okay. See you soon, Paula. Take care.
Bye.
Hey guys, thanks for sticking around to the end of the video. I really appreciate it. What you could do is you could hit the subscribe button if you haven't already. When you're ready to take the next step, why don't you click the link below and get into more information about my mentorship program, and I'll see you on the other side.